company was established several years ago, but the last 5 years we are devoted to offering medical services to all the patients facing up with oncology disease. And in that field, we develop a different kind of possibilities for our patients. First of all, we start cooperating with the RGCC, Research Genetic Cancer Center from Zug, Switzerland, starting with the laboratory, developing laboratory CTC measurement of the circulating tumor cells, as well as they are sensitive or resistance on different kind of treatments, which is possible to apply to any of the patient. After that, we develop a possibility for different kind of integrative oncology treatment of our patient, basically most on the supervision of Dr. Arthur Baric here in Thessaloniki, implementing all the possible things which is possible to apply for our patient. We start with the philosophy that it's very important to know, for any kind of physician, it's very important to know with what sort of person has some of disease, that instead of what kind of disease some person has, or for what Sir William also said, that the good physicians treat the disease and the great physicians treat the patient which has such a disease. Integrative oncology, as we find, combines all the medical, biomedical care with appropriate complementary therapies based on the diagnostic strategy which we made with RGCC laboratory, which help us to recognize, as I already told you, to recognize what kind of therapy will be appropriate for each of the specific patient. Complementary and alternative medicine can be used everywhere, and it's like time is passing, we find that more and more patients in the different age and different kind of disease can be treated on the integrative or complementary and alternative medicine. More than 6 million visits per year, we find that the patients are trying to find some different kind of approach to their treatments instead of, let's say, classical approach of oncology disease. So it shows us that we are on the right road, how to manage and what to do with the patients which are facing up with oncology disease. Like you know, on cancer treatments, we have different kind of classical approach like surgery, chemotherapy, or radiation therapy, but we add on our treatments hyperthermia and dendritic cells like immunotherapy when facing up with the oncology disease. In most cases, all this combination, it means combination of the therapy, is more effective and according basing of the diagnostic procedures. We develop a protocol to maximize dendritic cells performance by immune induction with whole body hyperthermia about 24 hours or in 24 hours after the application of the dendritic cells. And the dendritic cells can be infused both as IV route or target site injection, but in minimal dose disease patient, we can apply either like subcutaneous vaccination. Like a conclusion, I want to say that RGCC technology built up in RGCC laboratories enable us to applicate all kinds of integrative oncology to our patient, giving them completely targeted options. Without this, without previous diagnostical approach, when we find CTC program, and we find what's the number of the cells which is running around body and what kind of these moleculars are inside, and most important, what is their sensitivity to different kinds of therapies. All of this will be not available. And after that, second step, that RGCC technology gave us a possibility to revolutionize the practice of oncology. Due to the high prices of this kind of technology around the world, especially in Western Europe country, in collaboration with RGCC, we was able, and we are able in the moment, to focus on the middle class patient, which their budget didn't allow them to run around the world and to try to apply that kind of therapies. So we are targeting on the Balkan countries and adopt the prices of these therapies to the patient from Balkan countries, as well as some patients from USSR or from Middle East countries are also applied their therapies here in Thessaloniki. And that's it, what I have to tell you about our practice. Thanks for your attention. Thanks for time bringing us possibility to introduce what I'm doing.